like to share some thoughts on home health here. As you know that the problem in the United States is a big one with health. It's spending right now about 15% of its GDP, and it is going to rise to about 20% in the next 4 years. So that's about 2.6 trillion last year, dollars, total healthcare expenditure, private and public. But although my remarks will be primarily on the United States, a lot of the problems and issues are very similar to the countries in the rest of the world. For example, healthcare expenditures for the other developed countries where there is more of social medicine, the healthcare runs from about 18% to 58%, sorry, to 15%, and a lot of that is from public expenditures. It also means that with the aging population, as Franz had mentioned, there's going to be increased pressure on the tax base. Also, there is a global shortage of doctors and nurses, both in the developed and developing world going forward. Life expectancy is increasing, and there's an estimate that every year adds 3% of the total healthcare cost, healthcare bill. So these factors are true for all countries in the world, which also means then that when we talk of the digital divide, there is the potential for healthcare to be evaluated and in terms of some of these new technologies. And so with e-health or mobile health or telehealth, and the problem is there is no quite accepted definition of some of these terms. It's been changing ever since telehealth was created in 1923. But the general image is that there are some similarities between these technologies, and therefore you should be able to see a reduce in cost, increase in access to healthcare, particularly for the developing world. And so that begs the question, if that's so great, why is it not happening? Sort of a paradox. And so one of the things that I address in the paper and I'd like to summarize is the question, can telehealth and home health actually address some of these healthcare problems? Franz, in a way, had already brought up some of the issues with aging in place. And what are the obstacles, which is the more important thing? If there are values that can be generated, then why is it not happening? And I would use the Visor model as a way to explain some of the roadblocks and the challenges with healthcare. So the definition of health, e-health, is not really new. If you go back to the use of telemedicine, which was done in 1923, basically used for treatment of people on board ships when a doctor was not available. So telemedicine projects are in existence today, used primarily by the military and funded by the military, because it is very useful in forward battle areas. And so, in fact, if you look at the United States specifically, some of the advances in telemedicine is being generated by the military, where you can have remote operations done on servicemen in the field using this technology. Here, I'm going to take a bit of literal license to talk of e-health or digital home health as using telemedicine, but actually also expanding that by incorporating remote sensing, collaborative patient care, and access to libraries and medical databases. So that's generally the definition of e-health that most people have accepted today. But then the question is, what is mobile health, and what are some of the other parts of healthcare? But in a broad sense, is using technology to help supplement the medical treatment that you'll be able to get from the doctor. It's not replacing the face-to-face contact. It is trying to reduce and triage the occasion on when you need to go see a doctor. One of the problems with trying to look at roadblocks is everybody uses the term business model, but there is really no systematic agreement on what a business model is in the academic literature. And so one of the things that, like all good academics, instead of trying to solve the problem, we have come up with another business model to try and make it more exciting. But we would argue in the digital space, the 5 components of Visor help identify what are obstacles. And if you look at the various types of business models that are proposed in the digital space, they basically fall under these 5 broad categories. And it's value proposition, which looks at what customers value for the product or service. The interface, that is the relationship and the touch point between technology and the customer. The service platform, which is purely technical, how do you deliver the products and services. Organizing model is very important because it looks at the partnerships, and today in things like e-health, it requires an ecosystem approach. And finally, you have to make money. So what is the revenue model? And in the Visor model, we argue that all 5 have to be in place. We use this as a framework. It's not meant to be a theory. It's just meant to ability to identify what are the problems and how do you solve the problems. So I ask you to bear with me as I briefly explain what some of these components are and try to tie that back together when we try and address what the problems are in the US case particularly. So when we talk of the value proposition, it's a basic question: why does a customer or a user, or in this case a patient, want to use this technology? What is the unique thing about it? And we can discuss that in 4 aspects: compelling, to what extent it addresses a need, who uses it, what is the consumer segment, and is this something that is similar to what customers or patients are used to? So that is the complementarity. The co-creatability is something that would help enhance the value proposition if it allows the end user to personalize it. When we talk of interface, then this is, as I said, the link between the customer experience and the service platform, which is purely technology. So when we discuss interface, we can break it down in terms of questions revolving functionality. What can this device do? The form factor, of course, is relatively important in some cases, the aesthetics. Can you personalize it? This is the fluidity aspect, and which is very important. We would argue the forgiveness. If you make an error, what happens? Does it self-correct? For example, if you look at the Apple products, an iPad or iPod, they all fit this bill. This is a plug and play. And in some sense, the greatest advantage for me, actually, with the new Windows is the undo button. You can never make a mistake. Just undo the last step or last couple of steps. So this is one of the things that we talk about in terms of customer requirements, okay? And it comes very important when we talk of, excuse me, healthcare products. Service platform is the technical aspects, and while this model is general to any digital service, it has unique properties for digital health, as we will see. Here, we want to talk about the type of architecture. Is an open or closed system that you're using to deliver this product or service? Does it support different operating systems? It becomes important when you talk of the interface experience, the plug and play. And as Franz mentioned, interoperability issues also are affected by this. From a business model, do you build or do you build on existing systems, or do you build a new proprietary system? And finally, who gets access to this? So is it only a small community, or in this case, you'll see that with healthcare, it has to be open to all. Organizing model is the partnership management. So in a complex delivery system like eHealth, how do you design the processes among your partners to deliver that product or service? So with eHealth, for example, it's not only the doctors that are involved, they're service providers, they're equipment manufacturers. So how does the processes work? What type of partnerships do you pursue? Is it one that is long-term, which will be required for success? Is it formal partnerships, or is it a loose partnership? It's kind of like the decision that if you look at what Apple makes, it's open to all, and they don't have necessarily agreements, service-level agreements on some of these services. But this is the question that you have to address. Then pooling, if you're looking at the ecosystem approach, how do you pool the resources? What resources do you pool together to deliver this product or service? And then, of course, importantly is in partnership management, who actually runs the project? If you have 5 different companies, who's in charge? What is the relationship between these companies? And finally, in the revenue model, how do you price it? So is it the structure, payment? How do you handle the partner sharing? Then the product cost, and potentially what is the volume? And so just as a quick framework in mind, I want to discuss that in terms of the US health system. What is the value proposition? The value proposition, we would argue, is extremely high in the sense that aging in place is a big issue, as Franz mentioned. 95% of adults prefer to leave at home, particularly if they can. So that means some form of monitoring is important. If you can have an electronic way of patient compliance, that will help some of the problems related to chronic disease management. And the services are in place. HealthPel, for example, is a system in the United States that does transmit vital signs over the network. So in a way, it's not a technology issue. 51% of adults in some of the surveys by Pew particularly go online regularly to check on chronic disease maintenance. The four chronic diseases in the United States cost almost $1 trillion health maintenance. And this goes back to a statement made earlier about diabetes management. So if you look at the medical field, if you don't manage your diabetes, 15 years you will have one of these four chronic diseases. That's a given. And so you have, in many cases, health insurers like Humana now trying to develop games on mobile platforms where they argue if they can get their patients to monitor their glucose level using games, they will pay for the system. And so this is something that is very novel, where you have health insurers actually realizing that it is in their interest to try and help the patients control some of these disease. And so when you look at what are the devices out there, as many of you know, it's not new. There are devices out there. It's connecting to the network, and how do you build the business model that really becomes an issue. The internet is a popular use to get information on health. Many patients are very interested in being empowered to make decisions. Doctors actually prefer, or at least some doctors prefer, when patients do have some information about their healthcare condition and they are aware of what are the options. So the health sites online are very popular. In the US, this is a problem because of HIPAA regulations, so you find that many of the health sites do not really want to offer medical advice yet because of the potential lawsuits. But if you can solve that problem, you'll see that more and more the various treatment methods would be available online for you to look at. Some of the cost savings that you would have if you're able to transfer some of the treatment to the home. And this, again, is important going forward because of the lack of hospital beds, the fall in the number of clinical staff relative to the population. So if you can have more treatment at home, or monitoring at home, patient compliance, that will relieve a lot of the pressure on the health system. Excuse me. And again, although these figures are generally true for the United States, I would argue that most developed countries have the same problem going forward. Some of the examples of healthcare value proposition, the savings again from diabetes management. And in Europe, the European Union study show that the survival rates have increased if you have monitoring at home. And so you have the ability to actually reduce the cost and increase patient care significantly. On our study and in the paper, there's a bit more data on this. Patients and respondents are very, very supportive of information using cell phones and the internet. They are more and more asking for access to information. They would like very much to schedule doctor's appointment, if possible, online. They are going online to find what the symptoms mean. They are looking for support groups to be able to, especially for diseases like cancer, how do you deal with it? So there's a lot more interest over the years in using these technologies, particularly with smartphones and tablet devices, to be able to do management. And these all can connect on a network. So that's the beauty of these devices on a wide area network. Or incidentally, you can also attach this to a navigational device in the car. So this is something that I believe the South Koreans are experimenting with, where you have a sort of body vital station as one of your functions in your navigation system. So we would argue that the value proposition is high. One of the issues would be, how do you make a platform that is current with how people behave? So the mobile platforms that are in place today might be the right way to go, or some devices that are simple to use. one of the things also may be not to be to adopt a Swiss knife approach to devices, particularly with health, because then it sort of defeats the plug-and-play approach. So value proposition we think is high, but then there are challenges from the interface perspective. One of the things going forward is you must be able to accommodate whatever device, different physical capabilities of the patient. There's not an assumption that everybody behaves the same, not the usage, but actually the physical capability of patients. Form factor may not be important, but I think one of the issues would be it has to be for error correcting by itself. And this would help alleviate some of the problems right now. The devices have low compatibility with medical practices in the US. This has been true for the last 10 years. In other words, many of the equipment manufacturers are requiring that doctors change the way they practice medicine to be able to use the devices. Whereas a lot of doctors are saying, in some cases, yes, but in other cases, that doesn't help my treatment method. So the device, the way of connecting must be able to complement the way the doctors treat patients. At the home, this is a big issue because a home-based interface is not developed fully. And this is the chicken and egg problem because who is going to deploy devices on a large scale if they cannot connect? And there's a lot of legal issues related to this. From a service platform, we would argue that the scalability is a big issue. Last count, there were about 100,000 devices in telehealth, e-health devices in the US, produced by 100 manufacturers. How do you scale up? So the big hospitals and big insurers like Kaiser, if they scale up with 2.5 million patients, who is there to scale it up for them? And this is one of the issues going forward in this field. Right? How do you scale up to different companies? And of course, it has to be open to all. So this is one of the issues that I think network service providers have a vital role to play because of the ability to provide interoperability across devices by standards, and also the wide area networks available in this instance. Organizing model issues in the United States are challenging because right now there are over 12 agencies that regulate telehealth or e-health. They're not standardized. And that's probably true for if you look at the European Union. So here in the US, because e-health goes over some network, the Federal Communications Commission is involved. You have the potential of assignment of drugs, prescription drugs, which means the FDA is involved, and the DEA. And so this is at the state level. Then you have the federal level. Then you have the state level agencies. So here, if you have different levels, different legal definitions between the states, it presents a big problem for telecom service providers in the US, like AT&T, who don't really want to do it 50 different states and their regulations. So something has to be done in this case. And in this case, here is the question of does the telecom service provider provide the lead in being able to act as the keystone player in pulling together different partners across the healthcare ecosystem to deliver a product or service. One of the interesting things that is a big debate in the United States is the definition of telehealth or e-health. It is defined as bringing the doctor to the patient. And it might seem trivial if you think of why not patient to the doctor, but as some of you know, bringing a doctor to the patient means that now in any e-health application, the doctor has to be licensed in the state where the patient is accessing that service. If you define on the same network, telehealth as being patient to the doctor, then that need for multiple licensure across the United States is eliminated. The Telemedicine Association of America has been fighting this for 15 years. So this is just a complexity. And the revenue model, one of the issues that I think is important is how do you calculate costs and benefits. Right now, the data I just showed you show that there are significant savings from management of chronic diseases. And when you try to do the cost-benefit analysis of deploying a wide area network just to look at chronic diseases, then the numbers may not come out correctly. They may be extremely high. But there are two other aspects, I think, of e-health that need to be looked at. And this is, one is early surveillance. If you have a health system that not only looks at the way of how chronic disease is managed or early health vital sign warning, but what about pandemics? Can that system also support early detection of pandemics? Case in point, when SARS hit Hong Kong in 2004, Hong Kong had to shut down for 3 days. The corporations lost somewhere between $64 billion in that 3 days. The GDP for Hong Kong fell 1% for that year. How much increase in productivity would be gained if there was a system, a service that allows you to be alerted if there's an urgent matter, if your parent falls at home, or if it's minor, some agency takes care of the matter. What is that economic benefit, right? And so in any e-health system, do corporations have the benefit to pay beyond what they're paying for in healthcare costs to the employees, looking at early detection and wellness? So the interesting thing is none of these studies have been created. There's no real comprehensive look at the benefits of e-health. Some of the estimates on the wireless aspect in the US by Ovum, the most recent, shows about $145 billion only in terms of wireless efficiency in the hospitals. That's about it. Okay. So after painting a dismal look at e-health, are things going to change? I think they are for several reasons. So one of the things that in the United States particularly, there is a growing recognition, first, that the system is broke, and secondly, countries cannot be spending 15% of their GDP on healthcare. There are technologies in place. The question is, how do you put them in motion? The undeniable fact that you cannot change is the aging population globally and the rising cost of healthcare, plus the global shortage of doctors and nurses. This is a demographic fact that cannot be changed in the short or long run, actually. And you see that there is significant savings from all of these ways of using technology. The very interesting thing is, I mentioned that with the US, there are multiple agencies. The federal government actually can invoke the Dormant Commerce Clause. That's how the FCC and FDA were created. That means that because things like commerce transfer or transcend 50 states, then looking at individual state regulations is not effective, and that's how the FCC and the FDA has been created. So there is a push in the United States to create the Federal Commission on Telehealth, which means that half the problems, at least from the regulation perspective, will be solved, because this agency will be responsible for determining wireless versus drugs versus state requirements. You also see that a lot of the insurers, as I mentioned, have begun to look at this in a more positive light, because, again, health reduction in healthcare, patient compliance is the way that they see, the only way now to control healthcare costs in the US. So just to go back to the VISA framework, while the value proposition is high, there are significant roadblocks, so to speak, that need to be addressed in terms of how you deliver the service of the platform, how do you do the revenue sharing. And with that, I thank you for your kind attention.